idea behind WelTel really started was when we moved to Kenya. I moved there with the University of Manitoba, University of Nairobi program to look for an HIV/AIDS vaccine, and we were doing research there, but at the same time there were really two important trends emerging. One was that we were finally starting to get free HIV antiretroviral therapy for HIV patients. And at the same time, the trend was this incredible global trend of mobile phones entering people's hands and lives. And we saw the potential link between that trend and scaling up antiretroviral treatment as an opportunity to improve patient care. So in a randomized control trial, we found that patients who got SMS text messages were more than 20% more likely to achieve a good adherence outcome and treatment outcome than those who were getting standard care at the time. When I came back to Vancouver and discussing with our colleagues some of these challenges, we adopted the WelTel program here.
So WelTel is a two-way text messaging intervention or program that links clinicians and patients together. And so it gives clinicians the opportunity to check in with their patients once a week, and it gives patients the opportunity to respond and ask questions. And it's a way to fill the gap almost between clinic appointments so that people have contact with their clinicians if they want it and if they need it. So right now WelTel is being tested in the tuberculosis clinics in Vancouver and New Westminster, and it's being tested with people who have latent TB, and then a smaller pilot study is being done with people who have active tuberculosis. It's also being tested with HIV positive individuals at the Oak Tree Clinic, and then there are two studies going on where it's being tested with people with asthma.
Texting really allows patients to drive the care. Normally, if a patient is stable here, we're only usually seeing them in clinic once every 3 months, and they're welcome to call in between if things arise. But with WelTel, because it's a weekly check-in, we're hearing from them more frequently, and so as potential problems may arise, we get to hear about them in real time and therefore can act on them and triage them much more efficiently and effectively, in my opinion, when it's in that real time.
I also think that the patients, they like that instead of just seeing someone once a month, they feel like they're getting more care because they're receiving a message and that there's someone on the other end that's actually ensuring that they're doing okay. So it's like a weekly check-in as opposed to a monthly check-in.
In Canada, the 6 different studies that are going on right now are looking at different things, but the main thing is adherence.
It's thought that about $10 billion are lost in the health system due to non-adherence to medication per year.
Just 2 weeks ago, I had a young woman text. She had just joined WelTel, and so we had let her know that if she noticed any side effects on the day she started, that she should text us when she starts it, and that we'll continue to check in with her. And sure enough, on day 2, she said she noticed she was having some stomach upset. So immediately we could connect her with our pharmacist, who was able to give her some tips about how to manage that. The week later, when we saw her again, she had actually stayed on her medications. And so normally in the past, what would have happened is we would have started her on the medication, seen her in 2 weeks, and she would have said, oh yes, on day 2, I wasn't feeling very good and I stopped them. Where now we actually were able to help manage her through that period of time, and she was actually adherent for quite some time then.
I think the really interesting thing about WelTel is it can be used with many different conditions and for long-term conditions, as has been shown with HIV. We have used the same intervention with the same wording and the same frequency of text messages across conditions, and people all appreciate it in relatively the same way, that it offers support. And I think that that's a common thread when people are sick, is they want to feel cared for and supportive. And at the same time, it's a low-cost intervention and it's very easy to use. It doesn't require training, it doesn't require cost to the participant or that much cost to the clinic.
It's just a really nice way to streamline your workload, where with telephone calls, when you get a call, you have to act on it right at that time, or at least it's taking you time to have the conversation at that time. Where with texting, you can kind of compile your workload and triage all at once. And so from a practitioner perspective, I feel like that's been actually time saving or time conserving as opposed to creating additional workload.
I think WelTel, beyond just the technology, is a philosophy of not necessarily telling people what their healthcare needs are, but asking them. And so as a platform, it's a immensely valuable tool in reaching hard to reach communities and individuals.
Our vision really is then to really have a positively disruptive health system change, where we're providing a service very broadly that patients from around the globe, whether you're in Vancouver or Nairobi or northern British Columbia or the Yukon, where you may be able to be better engaged in care, point of care service, regardless of your health condition, where follow-up is required. So it can be an infectious disease, a chronic disease, but really that we develop a system that can be used in almost any clinical setting to better support patients in care in Canada and Kenya and around the globe.